The McConnell tape job is fairly easy. All you gotta do is spray down your adhesive, cut your strips of McConnell tape, apply them over the patella, and make sure you use an inside pull or a medial track pull. You can do 3 strips and make sure you overlap them on both of them. For the iscolateral tape job, we're gonna use either Tensoplast or Elasticon depending on what you have. And your strips are gonna start at the lower leg, then cross over above the patella and up to the thigh. Now these are 2 strips that start from outside, then start from the inside. They're directly opposite of each other, creating that X pattern that we see. Then the second pattern that we do will also start on the lower leg and angle below the patella up to the thigh. Again, this will create that X pattern. As you can see. Then from then on you can repeat this either twice or 3 times depending on your patient's preference. Once that is done, you apply a lateral and a medial strip, extending from the lower leg up to the thigh, running the whole length of the tape job. Then afterwards, apply your base strips, your anchors, and usually you will have either 3 or 4 anchors depending on the size of your patient. Try to make sure to angle up on anchors, that way it keeps a clean look and it won't come off as easily. This is the hyperextension taping technique. You want to apply your anchor strips first, and that'll be above and below the joint where you're trying to prevent the hyperextension. So in this instance, it'll be below the knee, closer to the calf, and then above the knee on the thigh. One or 2 base strips is good. Next step after that will be to apply a straight strip that moves from your lower anchors to your top anchors. Usually you can measure this out, then cut the tape, apply it, then you can fold it in. That way it's not catching whenever your patient is moving. After this, you apply a lateral to medial crossing pattern in the back of the knee, and then a medial to lateral strip that also crosses the knee. Once that is firmly attached, you close it up. The hip pointer taping technique, or wrap, uses a foam pad and an orthoplast above the site that is injured, and then afterwards you use an elastic bandage wrapped around, then closed up. All this is doing is dispersing any impact that would follow. This is your thigh compression wrap. You want to apply the elastic bandage from lateral to medial. You'll go above the hips, come through the most bony prominence known as the ASIS. Go through a couple times, then go back up, go back down, and notice how there's not a lot of tension when going through the hip, but mostly through the thigh. Then once closing up, you make sure you maintain that tension, and you can use more elastic tape for this. The groin wrap using elastic bandage is similar to the thigh wrap, but it is different in the way the tension is applied. So here, tension is going to be applied downward and in. Come back up, and again repeat that. Tension down and in. Go around the thigh, then you can angle it back up so you can have more tension aiding those strained muscles. All the tension is trying to help the leg adduct. Once that is done, either white tape or elastic tape can be used in the cleanup process. Last thing we got is the patella strap, and it's fairly simple. You use pre-wrap and wrap it around the knee in a circular pattern. Repeat it about 4 or 5 times, then roll it up, and you can ask your patient whether the tension is fine or not and adjust accordingly.